Sorry to interrupt the normal program here. Tony asked us to be very brief. For those of you who I don't know in the room, I'm State Representative Bryan Cutler, and this is State Representative Kyle Mullins. And we both have a very personal connection to Lou Gehrig's disease. I first met Ellen when I was 15. And at that time, both my parents had been diagnosed with ALS. And I have since went into a career in healthcare, and then ultimately I ran for the state house. And we've advocated for some time. So Gary and Paula were regular stops in my office for a very long time. And one of the things I always told the advocates when they came up was, tell your story. What's your why? Why are you here? And the why always has been, at least for me, and I think I can say this for Kyle as well, is that so someday in the future, someone will not have to come and talk about Lou Gehrig's disease because it's been cured. That is the ultimate why. And that is absolutely worth clapping for. The important part of that, though, is we have a lot of patients at this time who still need care. We live in Pennsylvania. Pennsylvania had the highest number of deployed military personnel, and for those who are not aware, our military veterans are twice as likely as the average population to develop Lou Gehrig's disease. So that is why this advocacy is important. We need it at the state level, we need it at the federal level. And for some time, we worked on a line item with Tony and Ellen and the team to ensure for direct patient care. And we've been successful in that. But Kyle and I undertook a new initiative recently, and it really was centered around all of the great clinics and the medical and health institutions and the research centers that we have here in the Commonwealth. So I appreciate your advocacy. I'm gonna let Kyle come up and we're gonna share this announcement together because it's been a long time coming.
Hi everybody, it's good to be back and see so many familiar faces. And I really appreciate my friend Bryan Cutler, who helped guide me as I accepted my dad's diagnosis. You know, I ran for office in 2018 with, the goal and idea that I think anyone should run for office with, and that's trying to help people, trying to make your community better when you stopped than when you started. But like so many of you know, life has a funny way of intervening and showing you your why, as Representative Cutler just mentioned. A few months into my first term, we noticed a worsening slur in my father's speech. We were actually in Ireland, and it wasn't the kind of slur you would think while you're enjoying Ireland. And just a few miles from here, a few months later, we sat shell-shocked as his neurologist shared that, yes, you have ALS. And Representative Cutler was the floor leader of the Pennsylvania House at the time, and I was just a freshman legislator, and I went up to him and I told him what was going on in my life. And he's been part of my support system and a friend and fellow advocate ever since. And that'll mean so much to me for the rest of my life. Thank you, Bryan. So although we lost Dad in 2022, I never lost hope because of the amazing researchers and clinicians working at our world-class institutions throughout Pennsylvania and throughout our country to try to make this a livable disease, a curable disease. But that doesn't happen without adequate funding. It was during that point in my life that I went into Governor Shapiro's office in his first year in office and said, it occurs to me we don't have, as a state, the direct skin in the game when it comes to funding our research institutions. And he said, I think that's a great idea, why don't you get to work on it? And ladies and gentlemen, a couple years later, and a whole lot of hard work, we're proud to share that just 2 days ago, we passed a state budget that includes, for the first time ever, a $5 million appropriation for neurodegenerative research here in the state of Pennsylvania. sometimes you feel that the only, outside of the hope or promise that your particular faith here on earth gives you, hope exists in research. And those doctors and clinicians and researchers who I met at this table, the real rock stars in my world, who are the ones who will realize that we are just one funding stream, one grant, one clinical trial away from that breakthrough to make this a livable, cured disease. Thank you all for being part of this effort and this club.